Assalamu alaikum and a very good morning to you all. I hope you guys are doing very well today and you're ready to start your day with me, Maha Maktoum, and the wonderful Shazad Khan on Well this morning. How are you, Shazad?
Absolutely perfect, and we hope that everybody who's tuned into PT World right now, they're great, they're fantastic, and they're smiling.
Fantastic?
Yeah, and they're smiling as well. Because you need to come up with your own terms as well. For example, fantabulous.
Oh gosh,
yeah, I love this term of mine.
This is a term you came up with this in the first year we started the show, and I begged him not to use that word.
But why not?
Because I don't like it.
But
Fantabulous sounds silly. The T, I don't like the sound of it.
I like the sound of it. That's what the thing is.
As long as you're happy and you like it, it's fine.
I think that's what you need to do. But then at the same time, Maha, what makes you smile?
Happy things.
Happy things, for example.
Or funny things, or like banter, conversation, hanging out with your friends, a good show, work going, everything.
But then have you witnessed that, that there are a lot of happy things happening around you, but then half of the time, people who are right in front of you, they might probably not even smile. They'll probably, if they'll smile, if my cameraman can zoom in, they'll smile like this. Yeah? Do you know what's the reason behind? Because their teeth aren't healthy and they do not look nice as well.
For anyone who missed that, from the profile, he's like pulling in his bottom lip to cover his bottom teeth.
Yeah, so what they do is that they cover their teeth with their lips just because of the fact that they've got spots on it, or I don't know, they do not brush them or they do not look after them. So this is what we are doing today, ladies and gentlemen. Today we are going to do a lot of myth busting. We're going to tell you that all of those people who think that, if a lady is going to give a birth and she's going to lose a
tooth every time. I mean,
is that true?
Is that true? Who knows? We'll find out. But no, also another thing is, we've always tried to make things happy and jolly. And like you always say, the best curve on a body is a smile.
Yes.
I couldn't remember exactly what it was. But no, so we're going to talk about that because at the end of the day, a nice, beautiful smile, it really, really, really changes a whole person's personality. And that's just creepy.
Yeah, and what we have done is that we've got 20 myths over here, which we'll be busting in 20 minutes. So let's see what type of a quick wrap-up it's going to be. But
yes, and I've also lost
today over here in the
notes.
studio, we have a very competent dentist as well, and a dental surgeon, I must say, and I might say, and let's see who it is.
Yes, we will. Once I found, because so many notes, I've actually lost them. I'm really sorry.
That's the best part. That's the beauty of life here.
Yes, exactly. No, we have been joined by the wonderful Dr. Saima Aleem. She is a dental surgeon. Assalamu alaikum. Thank you so much for joining us.
Thanks for having me here.
Thank you very much for coming over, and it's the best part. But then at the same time, since we have got these 20 myths over here, so we'll start quickly one by one. Maha, you do one, I do one, all right?
Okay.
So go ahead.
Okay, well, we're going to start with the one that we said in the introduction, that, within Pakistan, there is this misconception or this idea that every time a lady gives birth, her teeth are going to fall out or she'll lose one tooth. Is this true?
Well, to be very honest, and on a lighter note, I am a mother of 3 actually.
Okay.
And I have all my teeth intact, safe, sound, healthy.
Okay.
So, that is basically a misconception related to pregnancy. In our society, our part of the world, pregnancy is taken as a disease, which is actually not. During pregnancy, we have lots of hormonal changes taking place in our body, but at the end of the day, these are generally normal hormonal changes which are going to settle down after you are giving birth to a baby. But what happens in the oral cavity, during these hormonal changes, you are going to have your blood circulation increase, basically blood circulation. Then you have the inflammation in the gingiva, and at the end of all these things, you are going to have pregnancy-related gingivitis. Okay. So the pregnancy-related gingivitis actually going to cause bleeding and associated pains. So the pain and the bleeding that doesn't lead to extraction of the teeth or the mobility, like the things are not like that actually. So what happens is when a lady is pregnant and she is going to get the dental pains during pregnancy, what their common concept is or mindset is that we should go for the extraction.
Okay.
So if you are already have a mindset regarding extraction, you are definitely going to lose a teeth. But naturally, the things are other way around.
And also because during pregnancy, the baby takes a lot of the calcium as well. So I guess they kind of try to put 2 and 2 together.
No, but then what about the fathers?
Fathers should remain happy about it. In fact, fathers should motivate the mothers to have a good oral hygiene.
Yes, obviously. And the mothers should actually motivate the fathers as well to maintain your oral hygiene. That is very important. But moving on towards the next step, since, we started the conversation with pregnant women as well, now, most of the time what happens is that whenever a lady is pregnant and she's expecting, people say that, it's unnecessary to go for a dental treatment or probably, we should actually avoid it. Do you think that should happen or not?
Well, you know, things are not like that actually.
Oh.
Around 15 or 20 years back, there was a concept that you shouldn't have any type of dental treatments or any dental procedures during pregnancy. But you know, the second trimester is safest to have any sort of dental treatment, be it surgical or the endodontic or any conservative treatment. What happens during the first or third trimester is that the body is having lots of changes. It's undergoing changes. You have different reception to the pain and you have different threshold at the end of the pregnancy. So what is best for a pregnant lady is that you should go for dental treatment, any kind of dental treatment during the second trimester. But in first and third trimester, if you need any emergency dental treatment, you can consult your dentist. The dentist will take all your medical records, all your pregnancy history. You might be having high risk pregnancy. So obviously scenarios are going to change according to the situation. But the dental treatments, they are going to be provided to any pregnant lady in any trimester. But you should avoid unnecessary cosmetic treatment during pregnancy.
Okay, well, there you go. That's very good. So now once child is born, then he grows up into a little toddler and he starts teething. You know, terrible twos is a terrible time for a lot of parents. There's a lot of, I actually have seen this myself, and, you know, parents allow their kids to, you know, have all these sweets and, you know, they're drinking all this milk, or they're, you know, drinking Coca-Cola, or, I mean, a lot of kids in Pakistan drink Coke at a very young age, which is really, really strange. But the thing is, their teeth actually start rotting.
Exactly.
Like, as in, I've seen kids with really horrible, like, I'm
or
sorry.
even without teeth as well.
No, to the point that the half of them, you know, it's like something from Adam's family or something. And as a child, that shouldn't be happening. Now, a lot of the parents' attitude and reaction to this is that, well, they're going to fall out anyway, and, you know, you don't need to do anything about it. What is this situation?
You know, the problem is that we take our whole dentition, be it deciduous, the primary one, or the permanent one, as for granted.
Okay.
You know, the deciduous or the milky teeth are there in your mouth because of some reason, and the sole purpose for the deciduous is that they are going to guide or act as a pathway for the eruption of the permanent dentition.
Right.
So what happens is that when parents, they walk into our surgeries and they bring their child with lots of caries and for any reason, their first and most important demand is that let's get the teeth extracted.
Right away?
Right away.
Okay.
They don't consider any endodontic or conservative treatment for the milky tooth.
Okay.
So what happens is that there is a certain age for the shedding of the deciduous or milky teeth, which is 6 or 6.5 years. So before 6.5 years or 6 years, if you are going to get the tooth extracted, you are forcing your child or his dentition, permanent dentition, actually towards malocclusion. Or
what's malocclusion?
Malocclusion is where there are, you can say, the not properly aligned teeth.
So
there will be a crowding. Yes, you can have the crowding. The tooth will be not in the proper place or the positions, and you are going to have a haphazard eruption pattern. So what we tell the parents, or we try to basically guide them, is that you should go for the endodontic treatment or conservative treatment just like you go for the permanent dentition. So the deciduous teeth are as important for your kid as the permanent ones.
Okay, but then, you know, at this point of time, you know, I would probably go beyond what we actually said that we'll discuss. And since we're talking about kids and toddlers, what other treatments are available for all of those milky teeth out there?
You know, it depends on the condition of the tooth. Like if you have the caries, if you have any swelling or anything, we can go for simple fillings. We can go for dressings. We
And
can
milky
go.
teeth?
Yeah. Milky teeth, we can go all for all the endodontic treatment. We can go for pulp capping, pulpotomy, pulpectomy. We can do all the procedures on the deciduous teeth.
I was never aware of that.
No, is that? But how healthy is that for a child to be going through those things? That's fine?
Yes, it's fine, perfectly fine.
And isn't it painful?
No.
And also,
you know, all the treatment that we provide to kids, just like to any other adult, these are under anesthesia.
Okay.
And they are under the effect of local anesthesia. So for the kids, we have lignocaine gels, or we have the sprays for anesthetic effect. So obviously, we are trying our best to basically provide a child with the comfort level as well as for the minimal pain.
The minimum pain. Okay, fine. Now, in regards to these treatments, like, I mean, say for example, you know, the kid, do they have to do this? Is there any way else they can avoid these treatments? Because at the end of the day, because if you're 6 or 7, going to get a filling, it just seems wrong.
But I think parents just avoid it anyways. That's why you see all of these kids.
But you know, the best way to avoid the pain is to improve your oral hygiene. We have to teach or motivate our kids from the very young age, like from the toddlers. We have to teach them how to brush, when to brush and in which ways to brush actually.
Okay.
What happens in our society is that basically mothers are themselves not motivated to have a good brushing techniques or brushing habits evenly. So at the end of the day, if the mother is not brushing, if mother is not motivated, how can the child be motivating and having a good oral hygiene?
Right.
So you have to teach your child to have good oral hygiene, plus you have to control the bottle feeding basically. In the toddlers or the children under the 5 years of age, you have to control the bottle feeding. If the bottle is there in the mouth and the child is sleeping at the night, you are going to have the bottle feeding caries or the rampant caries, which are going to ultimately decay all the teeth, all the enamel, and eventually you are going to see the blackish or the Adams family basically.
The only problem is that mothers usually are habitual of brushing the floor rather than brushing their teeth
Exactly.
regularly. But right on, ladies
So
and
why
gentlemen.
don't you brush your kids' teeth? Like, I mean, you have to.
I mean, most of the time kids are reluctant to that.
That doesn't
So I've
matter.
gone
That's why you're their mother or father.
I've gone through that as well, and then, you know, it takes a lot of time to
What you do is
probably
you
convince.
grab the child, you stand in the bathroom, and you open
You
your
just
mouth.
don't understand when the kids cry with their tears.
I
and-
know, I
and,
get
"Eh, we don't want it."
I was a child too, and I do that to my mum and dad.
But do you remember that?
No, I was too young.
But
All
you
right.
know,
I was a good child.
but you know, you can make it a family habit actually.
All
If
right.
you have to teach your child to have a good brushing technique or good brushing or oral habits, you have to make it a appealing family habit.
Okay,
Yeah.
wonderful.
That's what we wanted to highlight. But ladies and gentlemen, right now we are going to share a small video with you guys, but not literally small. It's a bigger video, but you're going to understand quite a lot of things. So go ahead, take a look at it, and when you've understood all of it, we'll tell you something more.
General myths about dentistry. Removal of upper teeth affects vision. There is a myth among many people that removal of the upper teeth affects vision. This is a misconception. Vision is not affected in any way by undertaking treatment of the upper teeth, including its extraction, since teeth are no way connected to the eye nerves. An artificial set of teeth or complete denture that is made once is forever. While it is true that well-fitting dentures are used by the patient for many years, it is a myth that it can be retained forever. The oral tissues that lie below the dentures change over a period of time. But the dentures are made of stiff materials that do not adapt according to the changing contours of the oral tissues. Thus, even a well-fitting denture may not fit well after a few years. If an ill-fitting denture is continued to be worn, it can cause damage to the underlying tissues. Therefore, dentists advise changing of the dentures once in at least 5 years. Once a decayed tooth is treated, the dental problem is over. This is not true. Dental decay is treated by use of various restorative materials. However, the artificial material usually will not completely match the tooth in strength, color, smoothness, and other qualities. In addition, if the patient does not maintain good oral hygiene, decay can start again around restorations. Hence, whenever a tooth is filled or replaced, it requires use of additional cleaning methods like flossing, in addition to regular toothbrushing. Professional cleaning, scaling, removal of tartar loosens the teeth. Professional cleaning removes the tartar from the gaps surrounding the teeth and stops further destruction of supporting bone. Therefore, removal of tartar deposits does not loosen the teeth but helps to recover the health of teeth. Dental procedures are always painful. Most dental procedures are carried out under local anesthesia, which makes the procedures totally painless. In addition, the modern-day high-speed drills cause less vibration and are more comfortable for the patients. Dental treatment should be avoided during pregnancy. This is not true. Many a times, a dental treatment is provided even during late pregnancy. Routine dental procedures can be carried out without any fear. However, major surgical procedures may require medical opinion before treatment. Dental x-rays are to be avoided during the first 3 months of pregnancy. Cleaning the teeth with finger and powder is better than with toothbrush. A toothbrush has long bristles that reach almost all the surfaces and corners of the teeth to clean plaque and food particles. A finger may not reach all the areas where a brush can. Therefore, it is recommended to use a toothbrush with paste to clean the teeth and freshen up the mouth. Finger can only be used to massage the gums after brushing is complete. A child never needs cleaning of milk teeth. It is a myth that we need not clean a child's teeth. Children are as much prone to dental decay or gum disease as adults. In fact, children tend to have sweet food including sweetened milk and juices which can promote dental caries. So it is advisable to start the habit of cleaning the infant's teeth soon after they appear in the mouth. In fact, it is advised to clean baby's gum pads every day by gentle massage even before the teeth erupt. Milk teeth need not be taken care of, as they last only for a few years, and these teeth will anyways be replaced by permanent teeth. Early loss of milk teeth leads to drifting of the adjacent teeth and closure of some of the space that is required for the succeeding permanent teeth to erupt. Such a loss of space will cause the permanent teeth to erupt in irregular position and result in crowding. Therefore, milk teeth need to be taken care of as much as permanent teeth. When the gums bleed, it is better not to brush the teeth. Bleeding of gums is a sign that they are inflamed and are not healthy. This usually is a result of plaque and food particles accumulating around the teeth. Until this collection is not removed, the gums continue to bleed. This is an indication that the individual needs to visit a dentist for opinion and treatment. Brushing the teeth with a soft toothbrush by the proper technique removes the plaque and helps the gums recover. Initial bleeding seen during brushing gradually reduces over a period of time. Keeping an aspirin tablet beside a painful tooth reduces the tooth pain. A toothache cannot be relieved by placing an aspirin tablet anywhere in the mouth. In fact, this is a dangerous habit as it causes burns of the soft tissue around the area of placement. Hence, aspirin tablets should not be placed in mouth but swallowed after eating some food to relieve the pain. Does using a toothpick widen the gap between teeth? No. Using a toothpick does not cause gaps between teeth. You can use a plastic or wood toothpick, but not a metal pin, as it may cause an infection.
Welcome back, everyone, and that was a video just to show you more information about dental hygiene, especially for children and all these things, and lots of information in there. Okay, now, so the next question. So we talked about the children before we shared the video. Now let's talk about the extraction of teeth. There's some crazy myths out there, by the way, guys. So there's one that if you have your upper teeth removed, that it'll affect your vision.
You know what happened is basically the people take the
For a while, probably.
Yeah.
Oh, I can't
That's
see
probably
a
the
thing.
medication or something.
I have got my tooth extracted and now I can't see anything. So, you know, the things are not like that actually. Basically, what happens is that all the dentition, be it maxillary or the mandibular, they are supplied by the trigeminal nerve, okay?
Okay,
So,
that's all, no, I don't think
technical.
anyone understood that.
Yes.
So now, in
But
layers
it's
terms.
okay.
trigeminal.
it's a nerve actually.
All right.
What happened is that like any other part of the body, your teeth or the oral cavity, they are also supplied by the nerves. So what happened is that one nerve which is coming or giving off its branches to your maxilla or the mandible, means upper and lower jaw. That is all.
Upper and lower jaw.
Yes, I try to make it more simple actually. Good. So that is giving another branch, which is the ophthalmic nerve, which is actually related to some part of your vision or the dilatation of your pupil actually.
Okay.
So what people basically try to confuse is that if you are going to get your upper teeth extracted, so you are going to lose your vision or you are going to basically have some hindrance in your vision, which is not the case actually. The nerves, how can I make it more easy?
That's fine.
Yeah.
That's
A
okay.
nerve is a nerve
That's
actually. Yeah, exactly. Exactly. A nerve is a nerve actually. So the nerve that is supplying your upper teeth, the maxillary nerve, that is not going to affect or cause any problem to your vision actually. So you don't have to link the two things. You have to be very clear about the thing that if you are going to get your upper teeth extracted, it is at any cost no way related to your vision.
Okay, but then, you know, a decade or 2 decades earlier, people had this vision that, you know, if you have got pain in your teeth, so you should probably get it extracted other than going for a root canal, because root canal back then was, you know, they thought that it was the worst ever nightmare and going to be painful. Well, I've gone through a root canal. I don't think that it's painful anyways. But women, they, you know, they have a habit of screaming and shouting just when they see needles.
You know, it's lucky it's funny.
Just when they see needles. But then, do you think, what is better? Root canal is better or getting it extracted?
You know,
I'm going to show him a needle soon and see how he reacts, guys.
You know, unfortunately, in our part of the world, we are still not able to change the mindset of getting extraction as the sole treatment or choice of treatment for any dental problem or the dental pain. So what happens is that you have other choices available as well. When you go for a willingness, or you show your willingness, or you get your tooth extracted, what happens is that you are going to cause or affect the surrounding teeth as well and the opposing lower teeth as well. So you know, if you get your one tooth extracted because of your own choice or whatsoever reason are there, the opposing teeth, they are going to over-erupt.
If you're not going to get your dentures.
Yes, exactly, because you know you need some opposing force over there. Plus the surrounding teeth, which are in the same arch, they are going to cause some drifting and shifting mesially. So you know there are many other options available instead of going directly for an extraction. What other treatments are available? These are, you can go for the fillings, you can go for the root canal. Even if worst cases, if you have to get the extraction, you can go for implant. The people, they don't consider implant as a good treatment because they consider it that, oh, implant is costly, so why should we go for the implant? But you have many other better choices instead of going straight away for the extraction.
Okay, but then at the same time, you know, I've seen a lot of x-rays and I've seen a lot of people who might not feel the pain and the swelling's not there. But then when you see their x-rays, they have something over here probably, you know, just right under their teeth. It's
My wisdom tooth is going
and it's tooth as well at times, and it's not in the proper shape and it does not hurt them. So does that mean that they need to get it removed or let it be?
It depends on the condition.
That's the condition is that they don't feel any pain. There's nothing wrong, but the X-ray says that for a while they felt the pain.
But the X-ray will actually say there is some sign of inflammation or there is some infection going on over there. But any inflammation or infection is not actually the indication of extraction. You can go for your root canal. You can go for your pulpectomy, pulpotomy, any conservative treatment so as to save the tooth within your socket.
Thank God you didn't say phlebotomy as well, man. I mean, all of these terms. Well, phlebotomy is not related to dentistry, though.
Okay, so the next question is so funny. Next question, okay, so if we have
myth-busting's fun.
Yeah, myth-busting is really fun. Actually, it's really funny as well. Now, when you're brushing your teeth, like a lot of people have this issue that you know, they brush it really hard, or even if they don't brush it hard, they get bleeding and they get you know, when they floss as well, there's blood there. What does that actually mean? What does that indicate?
When you know basically the bleeding of the gum, it is indicative of the inflammation of the gum actually. In simple terms, and to make things understandable to the people, inflammation
We're not that
is
stupid, okay? We do understand a little bit.
Yes, but you know, when there is bleeding or inflammation, it straight away means that there is some bacterial or microorganism activity going on within your oral cavity. So in that case, you have to have a vigorous and improved oral hygiene regime which you have to follow. Now what happens is that when there is a sign of bleeding or inflammation or swelling anywhere in your oral cavity and your gums, what people do is they ultimately stop brushing. They stop brushing totally. And the reason is that, oh, we were having the inflammation or bleeding or pain, so we thought that we should stop brushing. the thing, yeah, it actually happens actually.
Guys, come on.
You know, the people who are walking to our surgeries, many of them are those who are not even having like regular brushing routine for last 10 or 15 years. And they take it for granted.
But thank you very much for busting all of these myths, and you know.
Yeah, we run out of time, but there's so many more myths we have. We have like over like half a list.
Yeah.
What we'll do is that we'll probably invite you in another show. We'll disturb you for that reason.
Yes,
but
we
ladies
will.
and gentlemen, that was a bit of myth busting on our behalf, and what you need to do is that you need to look after your hygiene.
Yes.
And you know, you probably, because these days there's hygiene as well. Sorry, I'm being a bit funny, but other than that, the segment ends over here. We'll come back with a bigger bang and with a bigger segment. Let's do this. Let's take a break. All right, ladies and gentlemen, we are back with a bigger segment and with a bigger bang because of the fact that the person who's on the show today is somebody very amazing. You know, because usually, Maha, when you think that you'll race me, for example, if we run and race, do you think that you will win?
No, because I'm not a runner unless I'm being chased.
Even I'm not. That probably by
So
a
I
dog
would,
too
I'd
as
be like,
well.
you go ahead, I'll see you at the end.
But you know, this lady who's on the show, she's won like 32 consecutive rock climbing competitions.
Yes.
And
Two national championships.
2 national championships.
4 against men as well within these
4
national
against
levels.
men. Wow.
And she does a lot more. There's a lot. She's also a paraglider. And also, you all know who we're talking about now. That we. So that just gave the whole thing away. We're going to build it up with women's role and all that stuff. But no, at the end of the day, like we've been trying to promote women's sport and, you know, women who are actually out there achieving a lot and actually working to open these opportunities for other women and get rid of this stereotype and that women can't compete against men.
And you know, the best part is that, you know, obviously we're going to introduce her just in a minute, but then the best part about her is that she's actually as intelligent as, you know, anyone can be, because she's done her MPhil, you know, with best grades, and then she's doing rock climbing. So that means that women can, and paragliding, and then that means that women can actually play a very pivotal role in building up the society and probably raising our flag.
Exactly. I'm not probably, they can most definitely, because without women, we're not going to go anywhere. And also one last thing is that, you know, I did have a point, but I can't remember. I'll make it during the show. But I think we should introduce our guest because we have so much to talk about. And one biggest thing is, sorry, I will let you finish your point in a second. She is from FATA. She's from the Bajo Agency. I'm sorry if I mispronounced that. And also the fact is we do live in a patriarchal society and world. And, you know, there needs to be women out there who are actually raising the flag and showing that, you know, guys, let's
So this
be
lady,
real.
which you have been actually watching on your television screen, but you cannot see her face, is none other than Miss Nazia. Hello, Nazia. How are you? Thank you very much for being on the show.
I'm fine, alhamdulillah.
Good. Thank you so much for being here. It's an absolute pleasure to have you on the show. You've achieved so much in such a short amount of time. Although you've been doing it since you were a child, you know, your brother, I've read one of your interviews where you were climbing rocks and walls instead of playing with dolls. That's what he said. But tell us, how did you get onto this journey?
I started my journey in rock climbing in 2010 March. That was the first time by chance I just came for the climbing, and I lost my first competition.
Okay.
That was the time, and that was the thing which pinched me the most. And I was like, why I can't do this when others can? So after that I started proper practice, and till date I never stood second. I got first position in each and every competition.
But before
Wonderful.
2010, did you ever, like, for example, if you're going on a picnic and you're up on mountains, would you like go climb somewhere on a higher top, or would you do things like
It's in my
this?
blood, because I belong to Bajo Agency, so it's mountainous area. So I used to say that I love climbing trees, I love climbing walls, and viewing things from an above place, or viewing nature from above. It's always fascinate me.
It's wonderful, because you're also a paraglider as well.
Yeah,
And you're
I
doing a
am.
lot of stuff there, but we will move on to that in a bit. I want to talk about your climbing career. I tried rock climbing. And no, I used to climb in England, right? But then I tried it here, and I got halfway up the beginner wall, and I started freaking out.
And then?
And then I obviously had to come back down because I was too scared to go any further. I'm going to try and overcome this.
I thought you fell
now,
down.
you're from, no.
And that happened.
But you're from that area, and, you know, it's in your blood, you know. Also genetically, you guys are more kind of better with the altitude, etc. So do you think that's helped you in your competition since you started actual training?
Obviously it helps, but the most important thing is when you focus and you practice.
Okay.
Nothing is possible without that. So I think we have a lot of potential, but people come and just they pass their time, take pictures and go away. So I just took it seriously, and I never knew that it will become a career or I will be so passionate about it. So I think your practice matters, and if you think that you can do, nobody can stop you from doing
But
that.
how seriously did you take it? Because, you know, the way you're saying it, that means that you're very ambitious, that the very first competition, when you lost it, and since then, you know, you have prepared yourself, and then you might have looked after every aspect of life, that, okay, how to achieve this goal. So what made you so strong from within that you never lost your focus?
I think it's just because I'm Kabaili or my parents brought up. Because my father always told me that, beta, you are Ashraful Makhlukat, you are human beings, so there is nothing you can't do.
Yeah.
So I think this was the most important thing when I went for the competition, and this was the most pinching as well when I saw that I cannot climb, why not? So that helped me in my normal life as well, because I always take things seriously, and when I feel that I can't do something, I just start doing it.
Okay.
I just don't give up easily, I just don't leave anything easily.
Okay, you persevere and you don't give up. That's absolutely fantastic, and I think that's a lot of things that people, you know, we as a youth or as a community, we lack that a little bit.
Yeah.
You know, we give up very easily. We're like, oh, what's the point? It's too hard. Like, kya fayda? Kya hoga? Kya fayda?
But right now, ladies
I
and gen-
think even if you fail after trying, you are satisfied.
Exactly.
after trying, obviously.
No, but
after
no,
trying.
but the thing
yeah.
is, I want to ask you, because as you are a sportswoman, you know, and obviously as a sportsman, your aim is to win. Because as a sports person, if you don't win, then you're not doing so well in your career. Now, you've won everything since your first time. Now, when you see other people, other girls coming up, you know, how does that make you feel? Do you encourage them, or do you see it as competition, or are you trying to bring the whole rock climbing industry up?
I always try to show the capable women, because the women in Pakistan are privileged. They get so many opportunities, so much respect that you can't get in any
Thank
other
you for
country.
saying that.
So
You can't
it's a male dominant society, but still we have to face such certain stereotype things. But I think women are the 52% of this state, so we should encourage them, and they should come forward to take part in the national development or making the positive image of
In every walk of
Pakistan.
life.
Exactly, but the thing is now, for example, you know, yes, they have, you know, a certain amount of respect here, or, you know, whichever, and, you
They're
know,
privileged.
not all of them, that's a very small segment of society, I think less than 10% if you look at the figures. But the thing is, women, when they want to go out, you know, maybe people of less privileged background.
Or exposure.
Yeah, or exposure, you know, like say the middle class or lower middle class. Now, you know, there's a lot of able, capable people that, how are you trying to encourage them to get out there? Because going to a wall, you are harnessed in, you know, there are a lot of men around. It is uncomfortable. I mean, when I was at the wall, there were a few people, and the boys do come and stand at the bottom of the wall when you're climbing at the top. So it isn't very nice. It's true. I don't want to give anyone ideas, because, you know, you shouldn't do that. So how do you deal with that, especially within this society?
I always see the positive side, because
tell us, show us.
in a male-dominant society, it's not easy for a woman to go out, and even my family was not ready to accept in beginning. I have to convince them that fine, it's a positive thing, and I will do it. They were like, no, there are so many other things. Go for shopping, go for this, go for that. Why for rock climbing? So I was like, I want to do this, because after that climb, I feel that I have achieved something, I have done something.
So there's a feeling of satisfaction.
Satisfaction matters, because if you are not satisfied, you can't do anything.
So right now, you know, what we're going to do is that we're going to share a video with people who are out there and who want to see you in action as well. Yes. So ladies and gentlemen, let's take a look.
Okay, guys, so that was a video of Nazia doing what she does best. She is a champion. She is undefeated in the last 32 competitions. That's wonderful.
But
now,
then there's one more thing which I wanted to ask. Sorry.
No, it's fine. I have a question too.
Okay, so now what I wanted to ask was, what type of satisfaction did you get when you actually won against men? And that too in rock climbing.
I think there shouldn't be any distinction between men and women. You are stronger from here. So it wasn't different, like it was like I have won a simple competition, but when people started encouraging and when people started taking it, okay, you have won from males, that was obviously like I have achieved something. And few people discouraged as well. There were few who used to say, okay, ये आई है इस competition में, we won't participate, because after that लोग ताने देते लड़की से हारी है, लड़की से हारे हैं. So I was disappointed as well, but after that I was like, okay, fine. There were few who were encouraging as well. So when I took part, I said, okay, fine, you don't take competition, don't take part in competition if you don't want to, but I will play. Good. So I did, and after that
what
they
about their
started
facial
practicing.
expressions as well when you won?
Obviously they were like,
I love that. She's truly satisfied.
I cannot explain.
No, I must feel so amazing.
But I think if you want to do something, you should see the positive side. If you will keep on searching for the negatives, you won't get satisfied. You won't go forward. So
really
I
good
think
attitude.
Okay, you should go for the positive things.
Okay, great. So, you know, apart from, okay, so you've done all these competitions, national level, you've won against, you know, top male climbers, you know, who then refuse to compete with you because, you know, their egos are that fragile, they can't handle losing to a more able, capable, skilled climber. Now, you've done everything, you've achieved everything in Pakistan. What are your next steps now? Because you know the rock climbing world here is kind of small.
I would love to go for the World Cup because
Olympic World Cup or World Cup?
It's World Cup or Olympic World
Okay,
Cup. Pakistan is paradise for paragliding and even for rock climbing, but it's unfortunate that we don't even participate in such competitions. We have talent, we all need is just to polish that, just to practice. So I think if we go on international level, when I went first time in 2014 to Singapore, I was like, fine, they are climbing since long and they must be having so much opportunities, they must be better. So when I went there, I was like, this much difference. So if we practice well and we get opportunities, we can do wonders. I wish to go for World Cup and I wish to go with a team of females, and I would love to bring the World Cup to the Pakistan.
I have a potential candidate for your team, my friend Rabia.
And we wish you best of luck for that venture too as well.
Thank you.
But now let's come back to the training sessions. Do you think that we have got competent coaches over here who can train well and, you know, we can compete internationally?
There are few, and there are a few international coaches as well. There are climbers, are climbers who come to Pakistan and they climb. But I told you earlier that people don't take it seriously.
Okay.
So I think Pakistan is a country where we have so much potential in climbing. So government and people is not taking sports seriously just because it's not an industry. Parents want that our kid should be doctor, engineer, just because their future is secure. So until and unless we take it seriously and we make it a sports industry where future is secure, people are not going to take it seriously.
And that's a brilliant message as well. But very quickly, few quick tips. For example, if we go someday, you know, for rock climbing.
How can I get past this halfway
very quick
point?
tips that, you know, just keep that in head and then go forward.
Just don't discourage yourself. Even if you are going to fall, say, fine, let me take 2 more steps and then I'll give up. Don't give up, because in rock climbing you have to take decision on each and every point.
Yeah.
Okay.
So it's all about if you are strong from here and you are encouraging yourself, then you can do it.
No, but what if you're out of breath and you run out of stamina as well?
Take a breath and you can come down, you can drink water at ease, just enjoy it. Don't make it something very difficult. You are just using your muscles.
And for all those, you know, new climbers out there, I'm not that new, but I seem to be going backwards. how do you get past that fear? Because I was there, I was like, one more step. I was like, no. I was like, no, one more step. I was like, because if you fall, it's
Height
really
phobia.
going, yeah.
Do you have it?
It's
A little bit.
natural. I mean, if you are human, you are scared of falling, you are scared of getting injured.
Don't wanna get
so, so it's like an addiction. Once
Okay.
you start climbing, you will love it. And because I'm a climber, so I would say that when you are climbing, you take it serious in your normal life as well. You become a challenge acceptor. You don't give up things easily.
Wow.
You are like, fine, I have taken decision at that time, why not here? You fight back. So I think those who want to, they should come and they should encourage themselves first, then others will encourage
Very
them.
wise and very nice.
Thank you so much, Nazia.
you.
It was an absolute pleasure talking to you. And we're going to share, we've shared a few videos as well. But, best of luck. And, we're going to be following your career very closely as well.
Thank
Thank
you.
you so much.
Thank you very much. And we appreciate our stars as well.
Thank
And this is what the government's doing.
Yes, exactly. So that was Nazia Parveen. She is one of our national champion at climbing these days, and she's also a paraglider as well. So, there are women out there who are doing these things, and yes, there are hurdles. Yes, just maybe, but a lot of our hurdles are self-created. These walls we put up, we've put them up ourselves, and I'm going to get back to that wall, and I'm going to reach the top.
Yeah, and if you guys want any information related to rock climbing or the clubs or the coaching, what you can do is that you can probably write to us on our Facebook fan page, which is with the name of
Well This Morning.
on Twitter.
Well This Morning without a G.
And then you can watch all of our previous episodes as well on Dailymotion and YouTube.
Well This Morning.
And the fabulous repeat is going to be at
5 past midnight. And you know what? I didn't take a photo because I was so scared. But next time when I reach the top, I'm going to put up a photo on our page. So
So till the next time, 1, 2, 3, good morning.